For many women, giving birth is a life-defining moment, one which they want as much choice and control over as possible. But data shared exclusively with ITV News has revealed that for those wanting to give birth at home, that choice is often being restricted or even removed altogether. So why are so many struggling to have home births? I'm Lucy Watson, and this is what you need to know. Well, I'm joined now by our health correspondent, Rebecca Barry, to chat through all of this with us. First of all, Rebecca, what have you found out?
Well, I was talking to the maternity rights charity Birthrights, and they told me that they were increasingly concerned about the number of reports they were hearing about either restrictions to or the suspension of home birth services. In fact, it was the number one, the most common form of inquiry that they were getting to their advice and support service. So they decided to investigate, and they agreed to share their findings exclusively with ITV News. They put out freedom of information requests to 145 NHS trusts across the UK, and they carried out surveys of women and people working in the maternity sector. And they found that 2/3, 66% of NHS trusts had either severely restricted, suspended or interrupted their home birth services in the 12 months between October 2023 and November 2024. They said,
so relatively recent anyway.
Yeah, it's the last year basically. They said that some trusts were putting in place what they described as severe restrictions or blanket restrictions on things like if the baby was predicted to be a certain size during the pregnancy or based on a woman's BMI. And they also say that they discovered really patchy, unreliable services. So women being told that, look, even if you want a home birth, we can't guarantee that a midwife might be available on that night or in that particular geographical area. And this is despite, and this is a really key point here, a woman's right to decide where and how she gives birth. That is actually protected by law, Article 8 of the Human Rights Act. And so it seems that despite that, in some cases, for some women, that right is being denied.
So, I mean, in all of this, what ultimately does that mean for women? What's the impact on them?
Well, I travelled to Sutton Coldfield in the West Midlands and met a lovely woman, Maya, and her adorable 4-month-old baby boy, Yuvraj. And she told me that she decided that she would like a home birth after having what she described as a sort of psychologically traumatic experience in her first birth in hospital. She said that she just felt that she'd be far more comfortable at home in her own setting. But she said that she just felt that she was ignored by the maternity services. They weren't listening to her requests. So she eventually actually referred herself to the home birth team. But even then, she was told that they couldn't guarantee that midwives would be available when she went into labour. She did eventually give birth at home. She described it as a beautiful experience, and her baby boy is healthy. But she said it took just months, really, of anxiety and uncertainty to get there.
The system itself is failing women. We shouldn't have to be fighting for what we want and a personal choice. I felt very angry about it. We should all be supported with the right advice. It was very stressful. I couldn't enjoy my pregnancy because of it.
Now, it's important to point out that a spokesperson for the hospital which provided Maya's care, Good Hope Hospital, told us that we would like to reassure mums-to-be that our home birth service was not and is not suspended. We try our utmost to accommodate every woman's right to choose a home birth where safe to do so.
I mean, Rebecca, are we ultimately putting this down to staffing? I mean, ahead of this chat, I spoke to a friend of mine who's a midwife, and actually my own midwife when I had my 2 boys, because she became a friend, because of the experience that birth is, you should form a very, very close attachment to them. And they said, well, there simply aren't enough midwives anywhere. This is not just home birth specific.
Totally. It is no secret, is it, that the UK has a chronic shortage of midwives. I think the current estimate is about 2,500 short in England. So obviously that is going to have an impact on NHS trusts being able to safely and fully staff home birth services. But those I've spoken to and the charity that conducted this research says, it's partly down to staff shortages, but it's also down to poor planning in places, a lack of staff training, and also a risk-averse culture, they say, which is actually disproportionately affecting the most marginalised in society, those who already have a risk of being less seen and heard in the system. So we know that black and brown women have much poorer outcomes in maternity care, and the charity says that this is simply fueling a distrust in the system. Also, people who don't have English as a first language, they will struggle more to navigate the system and therefore potentially be less able to push for their rights. And also people who perhaps are neurodivergent or have a disability, for those a hospital setting may or may not be right for them, and the charity says that they too are being disproportionately impacted by these restrictions. I spoke to Janaki Mahadevan, who's the CEO of Birthrights, and she just describes the situation as a national failure.
We often hear from people who feel completely let down, in despair, and they feel deeply frustrated that their choice is being restricted. We are essentially removing bodily autonomy and agency from people, which is a really fundamental problem and points to a real national failure.
I mean, national failure, that's a big statement. You talked just before we heard that clip about us being a risk-averse culture. And I mean, when I think about all my friends and when we were kind of obviously all having children around a similar time, who had what different, and everybody's experience is, of course, different. And home births didn't really feature, if I'm honest. I think I only know 2 women who've had home births. And I looked. I had a little Google last night, and only 2%, of births actually happen at home now. I mean, okay, 1959, but we're going back a long way. There was around 34%. Do you think home birth is safe? I mean, I suppose if I think about my own experience, and I'll just project a bit. I mean, there is no way. Mine was emergency C-section the first time, and then a planned C-section the second. The thought of what happened to me the first time, and had I opted or even thought about home birth, that was just a no-go situation.
Well, one of the reasons that some of the NHS trusts give for the reason that they've suspended their services is because of a lack of demand for them, that people don't want them. But the counter argument to that is it's because women aren't actually being offered the full array of choices. And if they're not informed, they're not going to think of it as an option. I mean, if you just look at this sort of official guidance, I guess, from the Royal College of Obstetricians and Gynecologists, they say that home births supported by a midwife in a healthy, low-risk pregnancy for a woman who's having her second or subsequent child, it might be a suitable option. But they do point out that for first births, there is, according to the evidence, a slightly increased risk of a poor outcome for the baby. But I guess that the key point here is women being given informed decision, being able to make an informed decision based on the facts and individual circumstances.
I mean, like we said at the very beginning, it is a life-defining moment. So it absolutely should be your choice about what you do with your own body, as well as your unborn child. Nobody wants to be dictated to over that.
Of course, and in certain circumstances, caesarean, as you've described, or any kind of medical other intervention is totally necessary and right and the safest thing for mother and baby. In other situations, it might be just that's what a woman feels happier and safer with. But there should be some level of choice. A woman should feel like she's having a say in her care.
Do you think, having watched the report, and overall I felt the sentiment, especially from the mother at the beginning, was that there seems to be much more of a need, a want for expectant mothers to feel more to feel more seen and more heard. That it's not just a foregone conclusion what they are going to do according to what the NHS says they should.
It's a human right. It's enshrined in law. And for the case of Maya, she actually says that, it spoiled her pregnancy and she's not going to go on to have any more children. So it has, real deep psychological impact on those affected.
Has the government said much about this?
Well, this research relates to all parts of the UK, and because health is a devolved issue, we actually contacted the governments of all parts of the UK, England, Wales, Scotland, Northern Ireland, and they all came back with fairly similar lines, but I'll read some of them to you. Department of Health in England told us that the government's determined to ensure women are listened to. The Welsh government told us that in Wales, women are supported to make informed decisions. Department of Health in Northern Ireland says that they offer midwifery service to women who choose to birth at home. And the Scottish Government told us they expect health boards to provide expectant mothers with the full range of choice. But our findings suggest that for some women in the UK, clearly the reality is falling short of those expectations.
And ultimately, did you feel like speaking to birthright, speaking to the mother, and also a midwife too, did you feel like there was an enthusiasm, I suppose, for home births to be more known about, I suppose? Because, I mean, the very idea of it is quite a lovely one, isn't it, really?
I guess everybody you speak to says that they're not pushing, excuse the pun, pushing one option over another. You know, it comes down to the individual, both their physical, psychological needs. So it's not a sense that one is preferable, but for some women, certainly being at home environment, if they're have a healthy, low-risk pregnancy, being at home, going back to natural instincts of being in a calm, safe place is more conducive to them having a happy, beautiful experience, as Maya described to me. But of course, there are cases where that's, not appropriate and that a hospital setting is right.
I mean, my friend, the one out of the two who I know had it, and she said it was a wonderful experience. She had a hospital birth the first time, relatively easy, if you can ever call birth that, and then the second one was at home, and it was really lovely. So maybe in time, with more information, more knowledge passed on, maybe that 2% number might indeed go up, maybe.
Well, it's interesting, the stats that you referenced back in the past, how much higher those numbers of home birth were. And there is an increased rate of medical intervention now. I mean, around more than 40% of births are by caesarean. And some people do express concern about, increasing medical intervention in birth.
Rebecca, thank you very much indeed for that. And for Rebecca's full report and all her health reporting, do go to itv.com/news. Remember, don't forget, you can subscribe to What You Need to Know wherever you get your podcasts and watch full episodes on ITVX and on YouTube. So until our next quick briefing, thanks for joining us.